This lecture is going to be on why and how do veterinary clinics dispense drugs. Well, the biggest reason why veterinary clinics dispense drugs that the veterinarians prescribe is for profit. Huge profit margin, usually 100 to 200% markup. For clients, it's practical. They're already at the clinic. Why do they need to drive to Walmart or another place to get the prescription when they already have it there? The other big reason is for client education. It's really important that we educate our clients completely with what these drugs do and the side effects that they may see. They can take their prescription to a human pharmacy, but there have been some errors. They will interchange a drug with another. They don't know what the side effects will be to the animal, so they can't advise the client. So once we have talked about dispensing, we have to talk about how we write that prescription, how we get that prescription made. Well, there's something called the VCPR, and this is the veterinary client-patient relationship. And this has to be established in order for you to dispense any drugs or for a veterinarian to prescribe any drugs. So we have our client here. The client has to be a client of the clinic. Okay, veterinarians cannot fill a prescription from another veterinarian. They have to agree to follow directions. And I wrote haha after here because clients do seem to have a hard time following directions. So as technicians, it's up to us to make sure that we communicate effectively with the client and get them to follow the directions that the doctor gives to them. The next thing is the veterinarian. Well, the veterinarian has to have sufficient knowledge of the animal to make that diagnosis, right? So if they haven't seen the animal, if the client calls up on the phone and says, my cat is doing this, they can't just prescribe the medication based on what the owner says over the phone. They have to actually see the animal, have significant knowledge of what's going on to make a diagnosis. They usually have to perform a physical exam. So they do the physical exam, which then gives them their diagnosis. And the other thing that a veterinarian has to be is available for follow-up. They have to be there if there's a problem with the medication, if there's an allergic reaction. The veterinarian agrees to do the follow-up. There is something in veterinary medicine. It's called extra label use. It is permitted by the FDA, and it is very, very common. It is done at the sole discretion of the veterinarian. The only time that we have to think about extra label drug use is with food animal. So a lot of times in small animal practice, extra label is used. The biggest one that you may see, ivermectin. This is labeled for cattle. We use it in dogs for sarcoptic mange. Okay. Another one is Meloxicam. This is labeled for dogs, but it is used off-label in cats for pain management. You do need to be aware that if you use a drug off-label, you should be informing the client of the risks of using this drug off-label. Meloxicam has a black box warning. It states that it may cause significant damage to a cat's renal kidneys. So what else has to be done with this veterinary client-patient relationship? Well, we have to do some things in the clinic. We need to maintain dispensing records. We need to maintain the treatment records of those animals. When you're dispensing medication, you only want to give the amount required. Don't give 300 pills if they only need 30. And there really should be no unlimited refills. The animals should be seen at least once a year if the doctor is giving them refills. And the final factor that I want to talk about is food-producing animals. According to the FDA, food-producing animals should not get medications that are labeled for human use unless they are prescribed by a veterinarian. Okay? If they are prescribed by a veterinarian, the veterinarian needs to make sure they try to use veterinary-only labels if possible. And they need to remember withdrawal time. This is really important. Withdrawal time varies depending on the types of medication that they use. Withdrawal, if they do not do appropriate withdrawal times, the meat can be tainted, as well as eggs or milk that we get from animals. So it's very, very important that we remember withdrawal time and with food-producing animals, and when we prescribe or dispense medication. Well, see you later. Bye.